Prescription audio is not just music therapy. It's not just feel-good or traditional sound therapy. It's not just anything. This presentation will show you how new technology, proven therapies, applied knowledge, and some innovative applications are delivering very specific and predictable responses by matching the electromagnetic frequency of specified cells at the cellular level. The technology has been called quantum harmonics, in an area that some are calling the new frontier of healing. There are over 100 billion cells in the human body. Quantum harmonics delivers precise audio frequencies that match cell types, which, when orchestrated, synchronize the cells to provide a predictable response range. Where observed response analysis has a level of randomness, quantum harmonics, with today's new technology, delivers precise frequencies to specific cell types to elicit a specific response and promote restoration and healing at the molecular level. MIT is even getting into the act. A recent study identified ways to determine specific cell frequencies to the point that they can determine if a cell is dying or not operating at full potential. The frequencies of these injured or dying cells is just slightly off the healthy cell's frequency. What MIT has identified illustrates one of the functions of quantum harmonics, synchronizing the frequencies of like cells in a cell group. If one cell is not functioning properly, then it affects the surrounding cells. If a large group of cells are not functioning properly, it can impact the functioning of the larger muscle group, organ, or cell group purpose. All of the health gurus say that if we did just 4 things, we would be a 50 to 70% physically healthier society. We need to lower our stress to sleep better. As we know, our bodies respond both emotionally and physically when we are in the fight or flight response. Contemporary stress tends to be more pervasive, persistent, and insidious because it stems primarily from psychological rather than physical threat. The if-then statement that the creators of prescription audio were looking to solve was something like this. If you could harness the power of sound to change a person's emotional or physical state, then the person's emotional or physical state could be managed in a totally benign manner without external substances and without negative side effects. That led to the hypothesis that a combination of evidence-based audio and sound techniques combined to elicit a predictable and repeatable response of lowering stress and related issues such as anxiety, anger, and sleep abnormalities. What has been proven is that through sound vibrations, stress can be lowered, anger reduced, sleep abnormalities lowered, and other positive responses can be achieved at a high rate of success. This hypothesis led to the development of the programs that are the backbone of prescription audio's line of therapies for stress, anxiety, insomnia, and addiction. The therapies have been proven to lower stress, anxiety, anger, cravings, reduce insomnia, improve quantity and quality of sleep, produce a calming effect. Some of the longer-term benefits include entrainment of the neural pathways and resiliency to stress and anxiety. Prescription audio sleep therapy Nocturne is a non-guided 60-minute sleep session delivered through stereo headphones, earbuds, headbands, or a speaker pillow. It is designed to be used nightly when the subject goes to bed as needed and on awakening during the night. In this study, we examined the effects of prescription audio sleep program in 6 patients, 5 female and 1 male. All 6 patients reported problems with falling or staying asleep. Patients were provided with a Nocturne non-guided audio program from Prescription Audio. Patients listened to the intervention for 60 minutes per day for at least 20 consecutive days. Patients underwent EEG evaluation 3 times, on day 1, between days 9 and 12, and between days 20 and 30. EEG evaluations were conducted during the day. 5 out of 6 patients reported improved sleep after listening to the program for 20 consecutive days, while the 6th patient reported feeling more relaxed, but only slight improvement in sleep. This patient's brainwave was typical. The first 10 minutes of each study were a control with no audio playing. On day 1, the patient resisted falling into deep sleep until nearly 20 minutes into the therapy. On day 12, the same patient achieved a delta sleep pattern 10 minutes into the therapy. On day 30, the patient actually anticipated the program start and fell into a deep delta sleep almost immediately, on the program startup, staying and remaining in deep sleep for the remainder of the program. The second sleep study involved over 60 subjects in an inpatient recovery treatment program. In this study, all subjects reported improved sleep quality and quantity, as reported on a symptom intensity scale. Additionally, subjects reported secondary positive benefits, including improvement in anxiety, mood swings, depression, pain reduction, and feelings of anger. This study highlights a 7-day sleep study of an addiction rehab patient in a residential setting. The therapy consisted of a 60-minute audio sleep therapy, nocturne, at bedtime played through MP3 player and earbuds. The patient recorded a self-defined severity of symptoms on a symptom intensity scale before administering therapy, symptoms in red, and post on waking, the symptoms in green. The patient was a 10-year alcoholic with severe insomnia. These charts illustrate the secondary benefits as reported by the same patient undergoing the sleep therapy. The stress management program includes a choice of therapies of varying lengths delivered through stereo headphones, earbuds, headbands, etc. The standard protocol is a 24-minute program to be used once daily, with 8 and 15-minute programs to be used as needed for acute stress and/or anxiety. The stress management program is routinely delivered through a multi-user distribution system in group therapy. The stress therapy study included 76 residential addiction rehab patients in group therapy, with pre-treatment results recorded in red and post-treatment results recorded in yellow. The green bars reflect the improvement in symptoms for cravings, stress, depression, mood swings, anxiety, resentment, anger, fear, body aches, and headaches. The green bars reflect the improvement in symptoms. The average change in each symptom score ranged from a 56% decrease to a 72% decrease in symptoms. We also conducted an EEG study of users on the stress program. In this study, we examined the effects of prescription audio for stress and anxiety in 5 female patients. All 5 patients reported symptoms of stress, anxiety, or feeling overwhelmed. Patients were provided with a non-guided audio relaxation program, Chill, from prescription audio. Patients listened to the intervention for 24 minutes per day for at least 20 consecutive days. Similar to the sleep program, subjects showed a marked improvement in the time that it took to achieve a deeply relaxed state over the 30-day period. Once again, by day 30, the subjects were able to achieve a relaxed state before the therapy actually started, simply by anticipating the start of the program. Prescription Audio's vibroacoustic addiction therapy, called Remind, combines the stress and anxiety program with a guided neurolinguistic addiction-specific program delivered through Prescription Audio's patented vibrational delivery method called the Satori chair. The vibroacoustic addiction therapy consists of 4 25-minute guided addiction rehab audio and vibrational therapy sessions. In this study of 76 residential inpatients, 33 were longitudinal, 4 sessions, and 43 were single sessions. The results of the single session users showed a marked improvement in all symptoms, with an average improvement in symptoms of 65% after their single vibroacoustic Satori session using the Remind addiction therapy. The study also used a symptom intensity scale to record pre-treatment symptoms before sessions 1 and before session 3, indicating a retention of symptom reduction over multiple sessions. And finally, this graph registers the improvement in all symptoms from pre-session 1 to post-session 3. The results of the vibroacoustic Satori addiction therapy indicate that all symptoms were reduced in severity in a single session. The decrease in symptom intensity ranged from 53 to 70%, with the most remarkable changes noted in the levels of cravings and anger. For more information on the prescription audio line of therapies, visit our website at www.prescriptionaudio.com.